You guys, thanks all for coming. Very much, I appreciate it. I'm Dr. Pam Nichols, and I own the Utah Dog Park and Animal Care Center. I'm really glad you all came. It is just almost 7 o'clock. We'll be starting Facebook Live momentarily. Before we started, I just wanted to quickly introduce most of my staff who are here. Julie Young is the manager of the Utah Dog Park. Becky is the general manager of the Animal Care Center and wine server of the night. Dr. Lauren Ainé is our newest doctor from France and Washington State. Dr. Cara Tassoni, everybody knows because she's a rock star and she has a beautiful baby daughter.
That's why she loves me.
I love her because she's a brilliant doctor and everybody who sees her loves her. Dr. Lindsay Wright is our military vet. She was with the military for 5 or 6 years before she came to us, and she's brilliant and talented, and we're very fortunate to have her. Dr. Allie Grover is our chiropractor, who's also married to Dr. Clint, who's also a chiropractor. He doesn't work on any of our dogs, so only Dr. Allie. Dr. Allie is due in December.
Yeah. What, you're pregnant?
Yes. Cat's out of the bag.
Dr. Verona Sherrick is another general practitioner who is our acupuncture specialist. She's been with me the longest of anybody, and she's a rock star and works mostly at the Utah Dog Park here in Salt Lake. We are going to have a fun evening. I will encourage you all to ask questions and stick around afterwards if you don't have your questions answered. I think we'll wrap up at about 7:45 and have questions afterwards. So feel free to interrupt, feel free to ask questions all the way through. The first person who is going to talk to you tonight is Dr. Lindsay. She's going to be talking about rehabilitation and a few other things. And then we're just going to work our way through Dr. Lindsay, Dr. Allie, and Dr. Verona. So with that, can I just say one more thing? I have these amazing staff in the audience that have been with me for a million years. Leah, I love you. Jordan, I love you guys. You're just amazing. Anyway, and Brianna. I'm Brianna, my long-term group. Where's Brianna? Oh, there you are. Brianna, my CBD person. Anyway, thanks you guys for coming. Gosh, great. Okay.
All right. Welcome, everybody. So we're here tonight to talk about some alternative therapies that are available in veterinary medicine. So whether you're just interested in pursuing a little bit less of a traditional route, if you have an interest in maybe a more natural course of treatment, or if you're just looking to think outside the box if our traditional therapies aren't working, there's a lot of options for managing different conditions within veterinary medicine with some of these alternative therapies. And our goal for tonight is to kind of open your minds and your eyes to a few different options that are available to you. And if you have any questions or things that we don't cover or you would love more information, come grab one of the docs afterwards and we'd be happy to talk about things. I'll try to use some case examples of some things that I've used these therapies for in the past, just so that way you have a little bit more of an idea on how this works on the everyday level. So the first therapy that I'm going to talk about is shockwave. So shockwave is kind of one of these things that when you hear that, you're like, ooh, that sounds fancy. What's shockwave? So what shockwave is it's a therapy that we can use for a variety of different conditions. So we use it a lot of times for things like osteoarthritis, or tendon ligament strains or injuries, so like the kiddos that get bicep tendonitis or maybe some of those Achilles injuries. We can also use this for things like chronic wounds that aren't healing very well, or has anybody ever had their pet diagnosed with anything like a little acral lick granuloma where they get a little lick spot where they just lick, lick, lick? And those are really, really hard to cure with some of our traditional therapies. So that's when we really reach outside the box and we think about things like shockwave. So what is shockwave? So it's highly focused shock waves that are produced by a little device, and it looks a lot like this picture. So this is one example of a veterinary specific product. And what it does is it targets these shock waves right at a direct spot. So it's a little bit different than some other therapies because it's a really targeted treatment, and it can actually go quite deep, up to 10 centimeters, depending on how heavy your machine is. And that's really different because that means that we can get to some of these areas that are more difficult to get to with some of our alternative therapies. So that's why it works really well for these big muscle bodies and things. And it's done very minimally invasive. So pets are anesthetized, and so that way it's very comfortable for them because the machine emits a little bit of a loud noise and has kind of a pulsing activity. So the pet wakes up and it's like nothing ever happened. They don't feel anything, there's no scars, there's no incision, and their problem is solved. And it varies depending on the patient how often this needs to be performed. We'll go into that a little bit on the next slide, but really sometimes one treatment is all it takes for some of these injuries to completely resolve, rather than months and months of things like chronic medications. So I think about kids that have bicep tendonitis, which is an inflammation of the tendon that runs on the front of the shoulder. These kids are sore, they limp, and they are very, very painful. And what we used to say is, let's rest these dogs for almost months at a time and give them lots and lots of pain medications and anti-inflammatories and hope that this swelling goes down. Now we have a nice alternative that puts these dogs back to normal function much quicker, which is pretty amazing, especially in the background that I come from. So I used to see a lot of, and still see a lot of working animals that we need them back doing their job quickly. So especially for our really active dogs that, you know, the idea of kennel resting them for 2 months just sounds like pure torture. These are really nice alternatives. And this is how the shock wave works. So the shock wave goes through the tissue and is then either absorbed or reflected depending on what it hits. So if it goes in and it hits bone, it's going to be reflected back. And then if it goes into muscle, it's going to be absorbed. And what it does is it helps to stimulate a few different types of healing factors. So it's going to encourage blood flow to these areas that are really hard to get blood flow to. It's going to bring all of these little chemical messengers that are called cytokines that help to decrease inflammation. And then we're also going to we can stimulate the bone, especially in something like a fracture that's just not healing really well, to start making new bone cells so it can actually begin the healing process. And one of the things that we also really like is it's very helpful to help control pain, because some of these dogs, like I said, that kiddo with that really sore shoulder, they're very, very painful, where a lot of times our traditional medications just don't cut it. That's where Shockwave really does a fantastic job of helping to increase serotonin levels, and that helps these kiddos control their pain, which is wonderful. And one of the other things that we really like, especially in our cases where our pets have osteoarthritis, is it's going into that area and it's binding all of those nasty free radicals and things that cause worsening osteoarthritis, and it helps to stop the joint from actually destroying itself, which is really, really important. On the picture of this dog are a few different areas on which we can use Shockwave. So we can use them within the wrists, within the shoulders, within the back, the hip, the stifle or knee joint, and also the Achilles or the hock. So there's a lot of different candidates who are there are a lot of different cases that would really benefit from something like shockwave therapy. Has anyone's pet ever had shockwave here? Yeah? What did you think?
It was great. I had a cattle dog who had a hyperextension injury of the wrist, and that helped get blood flow back to those ligaments and tendons.
How many treatments did it take?
I don't remember. I'm thinking maybe 6.
That's really 3 treatments? That's amazing. That's amazing, because so Dr. Pam, from a rehab standpoint, if you didn't go for Shockwave, how long would you be thinking about rehab and possibly even using something like a brace? It would be months.
A year.
Yeah.
Probably a year of rest and bracing, and still not necessarily a guaranteed return to function.
So this is a really big game changer, honestly, for a lot of diseases that used to just be either career enders, especially for our really athletic working animals, and it gets them back to feeling good so fast, which is just amazing, because gosh, it's so hard to put those young 2-year-olds in a kennel for a year. You know, I can't even imagine. So here's just a few little results, and this is actually a patient getting Shockwave on the Achilles. So 3 out of 4 dogs that were treated for non-healing fractures. So they had fractures that for some reason or another, were not coming together. They just weren't getting that bone to heal correctly. So 3 out of 4 dogs in a study showed great progress in bone healing and return to function. And they checked these guys, they had them walk on this special mat that measures how well are they putting their weight on their paws, and those dogs all had clinical improvement. They also found out that dogs with soft tissue shoulder injuries, so that little dog with a painful shoulder, 88% of those dogs were improving without any surgical intervention using shockwave therapy alone. And they've also found some really cool studies that they're starting to use this for wound management. They're using these on really big skin flaps, so dogs that have large tumors removed, burns, things along those lines. They're starting to use shockwave, and they're having improved skin flap survival, because that's the biggest complication of those surgeries, is that the skin flap doesn't survive. Dr. Pam, anything to add to shockwave?
No, you're doing great.
Okay.
Into
Right.
way more detail than I would have ever even thought. I was like, oh, I forgot that. So, nice job.
So now we're going to touch on some laser therapy. So this is Dr. Kara's kiddo, and he gets laser therapy 2 times a week, 3 times a week? Yeah, at least 2. So laser therapy sounds really, really scary when you first kind of hear the word laser. Who thinks of laser and they think of like cutting, like all these little red laser beams? The good news is that this is a really minimally invasive strategy. So the cold therapeutic CO2 laser is a low-level energy that enters the tissue, and what it helps to do is create a little condition called photobiomodulation, and that sounds really fancy, but it basically just says that it's bringing all of these healing factors to the area. So it's encouraging blood flow to go to these areas, it's decreasing inflammation within these sites, it's also encouraging these little nerve endings to start to regenerate and repopulate the area. And it also releases endorphins, and endorphins make us feel good. So these pets feel wonderful. So where's Kelly? Kelly, tell us about your laser experience recently.
Well, my dog, we found out she had horrible pain, and I brought her in. We did some back x-rays and some blood work, and they sent me for acupuncture. I was ready to put her down. It was horrible. And went in for the acupuncture. Her neck was really tight, which all 3 of you caught, everybody caught. And found out that she had a fractured neck. And so I just laser every day. We did acupuncture for 5 days. It was amazing. I never thought she'd make that.
And now
She
she's,
loves it. Now
yeah.
she sits there, she goes in there, she lays down, she's like,
It is. It's like a spa day. These pets, they sit on a nice comfy bed, and all they do is hold the laser right against the area that's affected. So whether that's a sore back, a sore neck, we had a kiddo that had surgery, that had a surgery site. So even something as routine as a castration or a spay or dental extractions, we're using things like laser therapy to start to speed up that healing process. And it's so safe, it's so gentle, it's so mild on the system that we're really finding that this is a great pain management option that we can use to supplement all of the things that we're already doing. So we're using these a lot of times for things like postoperative healing, wound healing. So say we have an area, so I had a kiddo that he tore a big gash in his side, and it was in a really bad spot where he would walk, and we weren't able to close it surgically because every time you try to close it, he would get active and he would open it back up. So every day we would do laser therapy to try to encourage blood flow and promote healing within this tissue, and we use that along with other medications to try to speed up the healing process. And the great news is these dogs do wonderful. Has anyone else used laser therapy with their pets? I was going to say, I think we got a lot of believers. We can also use it for really interesting things like rattlesnake bites. So this is something that I actually kind of found out as I was doing some research getting ready. So these types of injuries to the face where the animals have been bitten by an insect or something like a rattlesnake, they can help to promote the healing process as well. The next thing I thought I would touch on is stem cell therapy. So stem cell is an emerging area of research even within human medicine. So the idea behind stem cell is that you take these cells that can be anything. So these cells can turn into, so you have these little stem cells that can become muscle, they can become nerve, they can become bone, they can become fat, they can become all of these things, and we can use them in a way that we can help to treat a lot of our common illnesses within our pets. So in pets, there are a few diseases that this has been really well studied. So we can use it for things like osteoarthritis. That's one of the most common things that we can use this for, because what it can do is it can travel to these areas where there is inflammation or there is damage to the bone, to the joint, and help to rebuild these damaged surfaces. And we can also use it in things like chronic kidney disease. That's a really active area of research within veterinary medicine, is using things like stem cell for some of our more chronic diseases. Dr. Verona, you have a patient that receives it for her kidney disease, correct?
No, sadly that one passed away.
And for osteoarthritis.
The other one is for osteoarthritis.
And mom reports great clinical response after stem cell. A lot of the things that we see are increased range of motion, better control of pain management, and we can also see that these pets recover on a quicker timeline than we would expect with traditional therapies. So better return to function more quickly. All right. I was going to say that's just kind of a short little snippet on stem cell. Stem cell you can do a whole 2-hour presentation on stem cell. So massage, I think massage is another kind of neglected therapy that we can really use in a lot of our patients, especially for pain management. We use a lot of massage within our rehabilitation services to kind of combine with other therapies to help to promote relaxation within our pets, specifically within sore muscle groups. And at our next event that's going to be in November, Christina, who's one of our rehab technicians, is actually going to be doing a little snippet right at the end. She's going to teach us how to massage our pets. She is currently on vacation, so we're going to do that at the next visit. And one of the things that we see is that it can also reduce anxiety and stress, improve circulation and range of motion, and then also manage pain. So these are a lot of things that we can be doing with everything else that we're already doing.
I do massage and Reiki on my dog on a regular basis, and he loves it. He'll just relax and kind of get into it. Sometimes he'll let me know when I get to a tight spot, but after I'm all done, he gets up and shakes it off, and then he jumps around like, I'm so happy, and like, I feel so much better. Thank you, Mom, thank you. Oh. And I can see the difference in just one session. So I'm a big fan.
I love it.
Well, of course Helaman gets massaged.
I know. I feel good after my massages. And the last topic that I'm going to chat a little bit about is cannabis. So who hears that word and is like, oh, that sounds scary or illegal? Yeah? Yeah? I hear you. I did a lot, getting ready for this presentation, that's where mine goes kind of immediately, as my mind goes, oh man, that's kind of scary, that's a gray area. But I think it's a really exciting gray area where we're going to learn a lot about these types of products and things over the next few years as some of our laws and things change and as these products become more available and as they're researched. And the good news is the research is happening. The University of California Davis's vet school is doing some really awesome research that I'll share a little bit of their snippets. So I thought I'd kind of go over a little bit of the legalese first, so that way we can kind of separate what is the illegal stuff that we're not going to talk about, and then what is the legal stuff that is okay that we talk about. So when we talk about cannabis or marijuana, we're going to break that into two different things. We're going to break that into our CBD, and we have our CBD folks also in the back that have some products and things that they'd love to chat with you about if you have any questions. And then we have THC. So THC, illegal thing we're not going to talk about. CBD, new product that we are going to talk about. So
Legal.
yeah,
products.
legal, yes. So hemp contains primarily CBD. This is non-psychoactive, and it has anti-anxiety, antipsychotic, antispasmodic, and other anti-inflammatory properties. And then we have our THC, which is psychoactive, and then has all of those things that we're just not going to talk about today, but I kind of put up there. And one of the kind of things that I put up here is, like I said, this is an emerging area. We don't know a lot about it. Unfortunately, some of our federal regulations, even within CBD, have kind of hampered the research that's just now starting to happen. So as those rules and things are starting to become clarified, I think we're going to learn a lot more about these products. All right.
Can I add in a
Yeah.
little bit before she goes into uses? As veterinarians, one of our clients is the head of the DEA here in Salt Lake City, and I called her and I said, look, I want to know what CBD is and I want to know if I can use it. And she said, you can use it, you can sell it, you can promote it. You just can't say that it does anything because we don't know what it does. We know what it doesn't do. We know it's not going to hurt your pet. We know it's not going to hurt you. We don't for sure know what it does. So all of these things that Dr. Lindsay is going to talk about,
Yes.
it's legal. If the DEA were sitting in this room and we did invite her to come, they would be fine with us talking about it, and they would be fine with you using it. They would be fine with Brianna and her company selling it. They'll be fine when we sell it out of the animal care center. I just kind of wanted to let you guys know that little legal piece of this.
Yes.
So.
Yes. So the only legal requirement right now that Utah has said is it can't be in a treat and it can't be in food in regards to pets. So those are the two legal things that CBD is not allowed to be included in that our pets we can use for our pets. Those are the two kickers. And all of these things are things that have anecdotally and then I'm going to touch on a few where there are active areas of interest, but this is where the jury is still out. We're still learning a lot about these products, but this is how other veterinarians and other pet owners have been using these products. And this is how they're also used within the human field. So I think one of the most common uses of CBD is within our cancer patients. So these are our terminal patients who are suffering from cancer, where we are very concerned about quality of life at this point, and we can use things like CBD oil to promote appetite and to also manage pain. And that's one of the biggest things that we see with using these types of medications within, and most of this research is coming from human patients. I'll touch on the few that are veterinary specific. Nausea and vomiting, so our patients that are exhibiting GI signs potentially where they feel nauseous, they are having a hard time keeping anything down, but we need them to keep their calories up and to keep their nutrients. If these are patients that are suffering from end-stage chronic kidney disease, we have a friend. So suffering from end-stage renal disease where they're nauseous on a day-to-day basis quite regularly. This is something that we can use to help manage nausea. Inappetence as well. So maybe this is a pet that has very severe anxiety where when the owner goes out of town won't eat for days to weeks at a time very well. This is something that we could consider. We talked on pain management. In humans, this is actually also used, I think this is really interesting, in inflammatory bowel disease because of the anti-inflammatory effects that CBD oils have. And they're also starting to use these oils more frequently in things like epilepsy and seizures, and that's actually one of the research study groups that California Davis has going right now. Is there's a neurologist that's using CBD to help manage his seizure patients, and he's trying to assess how well is this working, and so far the news is pretty good. He's pretty confident that we're going to be able to use CBD in the future to help control some of our seizure patients more closely. And then the other area where UC Davis is enrolling patients, and so if any of you are very interested, we're close enough that I think that we could probably coordinate, is osteoarthritis. So one of their orthopedic specialists is doing an osteoarthritis study, and he's using CBD to help manage pain in those patients. Okay. CBD folks, anything that you would add? I know that this is kind of way more words up here than I said, but.
So the reason CBD is legal in, okay, sorry.
I'll leave that up for a second.
Is this not working? There it is.
Okay, so CBD legality is not from actually cannabis. If you get CBD from cannabis, it is still illegal because we're not a cannabis state. So CBD from industrial hemp. Is what is legal. And there's been, like you said, there's a ton of really cool things that are happening. But it's legal for humans, it's legal for pets in all 50 states, so everybody can benefit from it.
Right.
There's a question.
Oh, yeah.
Are those trials at Davis controlled?
They are. So they are blinded studies. They're double-blinded studies. So that means that there's a certain group of animals that are getting the CBD. There's a certain group that are not. The person who is doing the study has no idea who's in what group, so it's really objective. And they're assessing pain scores and things. The caveat, so this kind of touches on what Dr. Pam was touching on. So as of right now, with cannabis, as a veterinarian, I cannot say, yes, let's do this, let's add cannabis to your pet's treatment protocol. But we can advise you in safe ways to use our cannabinoids, so our CBDs, and what other people have been using them for and what we've seen to be effective thus far. And then I do want to highlight some of the things that we can see should a pet encounter a product that is from the more cannabis, so our scary, not legal in Utah for sure, area.
And stuff we're not going to talk about tonight.
Yeah, stuff. Well, just so that way, in case a pet gets into it, or if you're worried about side effects, these are worst possible scenario. Will not happen with CBD specifically, but should they get into a cannabis product. And that would be depression. They can act as if they were drunk. They'll be really lethargic. The last kiddo that I saw when I was in vet school just sat for 2 days with his head against the front of his cage. They hypersalivate. They're just really depressed and out of it. So if you are concerned your pet has gotten into any of these types of products and is exhibiting any of these symptoms, seek veterinary care. And then too, we can talk about what are our legal options, and as of this point, it is CBD, we touched on CBD is safe in everything, so CBD is legal in everything but a treat or a food. All right. And that was my CBD kind of. And if you would like any more specifics on different products and things that are available, I really encourage you to visit the CBD booth at the back at the end of our presentation. Okay, and I'm going to hand that over.
Okay, this is Dr. Allie, you guys. Thanks,
Yeah.
Dr. Lindsay. You're so good. We actually have a medical product that's it's a CBD product.
Perfect,
Combined
thank you.
with a lactobacillus probiotic for the GI tract that is going to be kind of fantastic that we expect to have in the next couple of weeks. Dr. Allie is a chiropractor. She's a rock star. She's a doctor of chiropractic, and she's also specialized completely in dogs. I think she's the only chiropractor in the state of Utah and probably in the entire western United States that specializes only in taking care of animal chiropractic. She's amazing. We're really lucky to have her on staff. And I think she's going to work on Carrie's puppy.
I am.
All right.
I'm going to do a little demonstration for you tonight, for those of you who haven't seen chiropractic on animals before. First, I'd like to see a show of hands is who of you have actually been to a chiropractor for yourself? Or maybe you know somebody that's gone to a chiropractor. Okay, so most of us are familiar with the concept of chiropractic or going to a chiropractor for various reasons, but maybe you didn't realize that this could also expand to help an animal as well. And not just dogs and cats, but really any animal that is a vertebrate, that has a spine, can benefit from a chiropractic adjustment. I work on a lot of horses on a regular basis. I've worked on cows and bulls. I've worked on snakes, bearded dragons, ferrets, rabbits. People bring me weird stuff sometimes. And sometimes it's just for fun. They're like, I just think it would be cool to do an adjustment on this. I'm like, okay, so we do. But it really is just a neat thing because all the same benefits that you could potentially achieve from chiropractic for yourself are things that could also help for animals as well. So tonight I'm going to talk a little bit about, number one, what is chiropractic, and just get a little more specific with that. Number two, what are things that you maybe would be looking for in your dog that could, or your cat or whatever, but to make you decide to bring them in, because people struggle with that. They say, well, how do I know if my dog needs an adjustment? And that's a very valid question, because they can't tell us all the time if they have pains or aches or problems. So I'm going to give you some ideas or ways to kind of think about that, or look at your animal from a different perspective to see if maybe they might need an adjustment. And then the third thing I'm going to touch on is which animals really are good candidates for chiropractic care. But before I do that, I'm going to just tell you a little bit briefly about my training that went into this, and also just in general some of the laws and legalities of chiropractic for animals, because there are some. Just like there is with everything in veterinary medicine. So as Dr. Pam said when she introduced me, I am a human I didn't say that right. I am a human chiropractor. I am certified in animal chiropractic. Currently, there is no specific school you can go to just learn animal chiropractic and become a doctor of animal chiropractic. They've thought about creating it. There just has not been a big enough avenue for it yet at this point. So currently, to become an animal chiropractor, either you are a veterinarian or you are a human chiropractor, and then you go through another extensive 220-hour program with board exams following it to become certified in animal chiropractic. And I have to do CE for animal chiropractic in addition to CE for human chiropractic to stay up in all my licensures and certifications. So it's pretty extensive. And people don't always realize this and think, well, I'll just take my dog to my local chiropractor, after hours, in the back door kind of a thing. And well, you could do that, but I wouldn't do it with my own dog, because I know what they teach in human chiropractic school. And they don't teach you an animal spine. They don't teach you the differences, and they don't teach you the cautionary elements of what you can adjust and not adjust on animals in certain situations. So there are animals that get hurt this way. And likewise, it's the same with the veterinary medicine. These doctors here don't always go and start doing adjustments on animals. They could legally, but they don't. They usually hand them over to me, except for Dr. Kara, who one time fixed Lily's elbow. Thank you. Yeah, the chiropractor couldn't figure out what was wrong with her dog. So anyway, but that being said, I just want you to realize that it is a certification in Utah legally. You have to be certified in it to adjust animals, and also you have to be working with vets. So that's where I thank Dr. Pam for allowing me to work with her team of wonderful veterinarians who are those people who help make sure that we're doing chiropractic on the right animals and getting the right animals better. So what is chiropractic? First of all, okay, so I brought you a little spine demo. I apologize, I don't actually have a dog spine, because they're not all that readily available and they're very expensive. But I did have a human spine, and they are similar enough that you will get the main idea from it when I do my little descriptions. The word chiropractic, chiro, C-H-I-R-O, is a Greek word. Do any of you know what it means? Of course. The other chiropractor knows. It means hand. The word chiro means hand. This one might be a little easier, practic. What do you think that might mean? Close. No, that's a good guess. Very good guess. Practic, it sounds almost the same in the English language. Add an E to the end. Practice. So to practice with the hands. That's one of the things that I love about chiropractic is we get to use our hands to help animals and to help people get better. And that's rare these days, to really be hands-on with your patients and touching them and feeling them and using, and a lot of people talk about just the benefits to people for being touched in massage, chiropractic, any of these methods. So chiropractic means to practice with the hands. And they do have tools these days to help with adjustments, but 99% of the time I use my hands to do adjustments, because that's how I can feel the things that I need to feel and feel the changes as they take place. So if this here, this spine here represents, of course, the spine of the body. It has three main functions. I'm going to have you guys help me out again with this. I'm going to see how much you remember from anatomy class. What would you say one of the three main functions are of the skeleton? Like the body, it doesn't matter, not just the spine, but your arm bones, your leg bones, head bones. Give me a function. What's that? Support. Foundation. Okay. Frame of the body. Support. Yes. So it's what everything else consists around. Okay. So frame, Number 2. Very good. Our Facebook guy over there even knows. So yes, and actually, in my opinion, that's the number 1 purpose for it, because if we didn't have our nervous system, we would be gone. That's the number 1 thing in our body is our nervous system, our brain, and it's sending the signals out to the rest of our body. So inside of this spine, you can actually see these little yellow things here are representing the nerves, and then there's a spinal cord right down the middle. So we're protecting that. And then the third function, this is a little trickier. I want you to think about, kind of goes back to it being a foundation for our body and a frame. What else is going on here besides we have more than just a skeleton? What makes us move, though? The skeleton wouldn't be able to move without muscles, says Shane. So the frame creates the attachment point for muscles. So where can this go wrong? With chiropractic, we are looking for something called a subluxation. That's a really fancy word that basically just means a really minuscule, small dislocation. So it's an issue where the joint's not quite together the way it should be. So if this was nice and lined up, and then let's say we had just a little bit of a twist to it, that might be what we would consider like a subluxation. It's not totally dislocated, but it's just a little off. It's out. If you go to your chiropractor and say, I think I'm out, that's what you're telling them is, I think I have a subluxation. So if you were twisted a little bit here, there's 3 things that could cause. Number 1, it could hurt a little bit, right? Because it's not sitting where it should. Number 2, it could affect the muscles that attach to that point. That's why sometimes when you wake up and you didn't sleep well, and you got a kink in your neck, and you're like, I can't even turn my head this direction anymore. That's because not only are your bones just a little bit misplaced, but then the muscles get angry as heck because their attachment points are messed up. So you see some really angry and sore and tense muscles. And then the third thing that can happen is if we have a little bit of a twist here, all of a sudden the space where that nerve is supposed to come out isn't as big as it used to be, or it's not as open. It doesn't have as good of movement as it used to. And so all of a sudden you get a little bit of pinching of nerves. And if you've ever had a sensation where you have nerve pain down your arm or you have nerve pain down the back of your leg, like sciatica, sometimes that's because you have a little bit of a bone out of place. Now, there can be other causes of nerve pain as well. It's not always because of a subluxation, but sometimes it is because of a subluxation. So those are the reasons right there. Those 3 points are basically the foundation for any problem that you might run into chiropractically. So I was going to just briefly go through, let's just go right down the whole body, okay? So a problem in the upper neck where the junction of the top of the spine meets the skull. Let me put this up here. In a dog, it could cause head shaking. It might cause recurrent ear infections. It could cause neck pain. It could cause headaches. How many of you have ever thought about dogs having headaches before? Okay, I love that the vets are raising their hands. We don't know if they do. We really don't. But I have suspected it so many times. When you see a dog that is just depressed and lethargic and just behavioral, yeah, and just not acting themselves. And it is so amazing when you do a little adjustment on that upper part of the neck, and it's like a light turns on. And all of a sudden it's like, oh. And then you call the owner a couple days later, and they're like, oh my gosh, they're acting like they have their life back again, and they're acting a lot more normal, and they're eating again, and they're not being antisocial anymore, and all these things. And Shane can actually attest to a couple times when I've worked with some of his fosters that have had upper cervical problems. Daily fights, he says. And so behavioral things that have been helped. Not always, I can't fix every behavioral problem, but sometimes it can be something like that. Lower down in the neck, this is a little bit more commonplace. If you've got a problem in the main cervical part of the spine, you're going to see neck pain. Neck pain is fairly obvious in dogs because they're going to have a hard time lifting their head up, and they're going to really guard it. They're not going to want to turn side to side, and it hurts. And because of the way dogs are positioned, we're lucky. We have gravity in our favor. They do not. So neck injuries are really difficult to work with in dogs. And Dr. Verona, with her acupuncture, can help neck pain a lot. So we will often work together on those neck patients, and they can be real tricky. Yeah.
Yawning, I noticed with Taylor, she could not yawn.
Okay.
She clamped down. Is that?
It can be. It can be an issue in the neck. That can also be a jaw problem as well, and probably a few other things too that could be involved with that, including the ears, because they have that connection with the eustachian tube. But I have seen yawning sometimes, common yawning, chewing kind of, or just having issues with their jaw in general. Yeah, that sometimes that's related. And I've actually worked on some dogs and done jaw adjustments. Tibby Wilder, Tibby's not here tonight, but vets know Tibby Wilder has sometimes had to have his jaw adjusted. Go figure, he always needs everything. So moving down the spine here, along with the neck pain, something I forgot to mention is sometimes you will see symptoms in their front arms with neck problems, because the nerves from the neck are nerves that go down into the front arms. So a dog that might have a lameness or a weakness in the front arm, it could end up being a neck issue. I need to hurry so Dr. Verona has time. Back, again, this one makes a little bit more sense. It's a little bit easier to see, because if your dog has back pain, they're going to tend to want to hunch their back to protect it. So if you see a dog that's pretty hunchy, or they're tucking their tail, and you go to pet them, they resist it. They may not want you. Maybe if you do pet them, they tense up or they kind of flinch under your hand. That can be a sign of back pain. Moving down the spine, this is the pelvis. This is so important in dogs. If there is a dog that has a pelvic problem, I will oftentimes hear from owners that when they're running around or they're walking around, that they kind of do it at an angle. I don't know if you've ever seen a dog that it's like their back end and their front end are disjunct from each other, and they've got this disconnect going on. A lot of times that's a pelvic misalignment. Sometimes they'll have a weakness in one of their hind legs with a pelvic problem. Pelvis is also, if the sacrum is out of alignment, sometimes I'll have dogs with urinary incontinence. I actually recently had a cause dog that I was working with urinary incontinence. When we'd adjust her sacrum, it would go away. And then when she would go back out of alignment, it was always because of that sacrum being out. And then we would fix it, and the urinary incontinence would get better. Low back issues going into the pelvis, so that lumbar into the sacral areas can sometimes also affect fecal incontinence as well. And then about the limbs, hind and front end limb issues, joints can go out, shoulders, elbows, knees, hips, you name it. They can also go out of alignment. I mentioned Dr. Kara adjusting my little dog Lily's elbow. We discovered she gets insanely limp, very gimpy, when her elbow goes out of alignment, to the point that she'll lift it up and not even use it. And I was convinced she had broken a bone or something. And I take her in, and I'm freaking out, and Dr. Kara is examining her and doing range of motion. All of a sudden, she goes like this with her elbow, and it pops. And then we put Lily down, and she's totally fine, just walks right off. Dr. Kara said, well, your dog had a subluxation. She was out of alignment. I was like, oh, I was so relieved, but it was really ironic, and I was quite embarrassed. But at least we figured it out. And now whenever she starts limping again, I adjust that elbow, and she gets better. So it's interesting. Sometimes you'll see things like that as well. So I'm going to do a demonstration on Loki over here. And Loki is a great example of, so I was going to talk about, too, what kind of dogs are good candidates for chiropractic. I work a lot on senior dogs. Chiropractic seems to really help a lot with arthritis. It just makes them a little bit more comfortable and gives them more movement in their joints. And Miss Loki has been receiving chiropractic care really since I started working at Animal Care Center about 5 years ago. And she's now 17 and a half. She's doing really well. She is a trooper, and she gets acupuncture, laser therapy, you name all these things we've been talking about tonight. Carrie's Loki's owner could tell you about, because she's done it with her dogs and has seen some great benefits from it. So clearly Loki is a senior dog, being 17 and a half. And I am going to be a little more gentle with her than I might when I do an adjustment, like let's say on a 2-year-old big Labrador Retriever, or something like that. That's one of the cool things about chiropractic, is because I use my hands, I can adapt it to big dogs, small dogs, anything in between, and the special needs that they have. The only times I would say really that you have to be a little bit cautious with chiropractic is when you have a dog that has an injury that's creating instability in the joint. So when we talk about instability, things that could mean would be a sprain or a strain of a tendon or ligament. So a dog that has a knee injury, I am not going to be going in and adjusting that knee. I sure as heck might adjust their pelvis or their back because they're going to be compensating, but you don't want to adjust something that has instability to it. Likewise, question? Hypermobility, correct. Thanks, Clint. Likewise, we're also very cautious about dogs who have acute disc injuries. A lot of people think, okay, well, if my dog blows a disc, is this something that we can help with chiropractic? Potentially, yes, but we have to wait until that area is stable before we can do it, because a lot of times following the initial injury of the disc, there's actually instability in the spine there. And so that's an area where we could actually do more harm than good to try to go in there and start putting manipulations in. And then the third area I'd say, or more common area that we have to be careful, is in dogs with cancer, because they can get brittle bones from the cancer, and we don't want to adjust bones that don't have enough stability to accept the adjustment. Okay, so Loki over here, I'll come over to the side. It's such a huge table, we don't need all of it. So when I do an adjustment on a dog, I start usually in the back because the pelvis is a nice foundation for the whole spine, and I want to make sure that their pelvis is balanced before I work my way up. And so right now I'm just checking either side of her pelvis, and actually her pelvis is perfectly balanced right now. This dog's been adjusted so much though that she's pretty good. And then while I'm back here, I check all the way down to toes, because sometimes toes will also misalign, and sometimes they will be hurt and we may not be realizing it. I've actually found a couple of broken toes in the past working on dogs because they are quite painful on their toe, but we may not have realized it. So I check toes, and I check ankles and stifles and hips. And then I work my way up the lumbar spine. The lumbar spine is the low back. And I just feel as I go and feel for areas where it's not quite in alignment or where it's restricted. And she often will tell me, I got right about here, and she's giving me a look. She's going, yeah, that's the spot. So I'm going to do a little adjustment on that one. And the adjustment, you're hardly even going to notice it. It's just a little thrust. Sometimes we have to do it a couple times before I'm happy with where it is. That's better. Keep working up. She's got a little spot right here at her junction between the thoracic and lumbar. You're okay, hon. It's actually been several months since Loki has had an adjustment, so she does need it today. Good girl. Check the ribs, see if there's anything out there. Front legs, Loki often has a shoulder out because she has the fun conformation. Good girl. You have that back. There you go. Some dogs hate having their paws messed with because they think you're going to mess with their nails. So
he falls asleep during nails. So.
So I do work with dogs that have specific, little preferences, and make sure that they're comfortable during the treatment. And then last of all, I always check their neck and finish with the neck because it's the most sensitive area of the body for them. You're fine. Good girl. She's like, I'm not used to having an audience for this. Do you notice she just licked her lips right after that adjustment? That's a common response after an adjustment. That's a little bit of a stress release that they do. Good girl. So today on her, I did the little adjustment at the very top of her neck. She had one right in the middle, and she had one right here. And actually for her, at her age, that's quite good. And Dr. Verona is going to come and talk to you about acupuncture and do a demonstration on Loki of acupuncture. I work a lot with Dr. Verona on patients, and they go hand in hand very well. All these modalities, the alternative things, the cool thing is you can use them together and get even greater benefits. So take it away, Dr. Verona.
Alrighty. Thanks, Dr. Alley.
Yay.
And thanks, Loki. You guys, we generally wrap up at 45 minutes and just have questions and answers. We're going to go all the way till 8 o'clock, so Dr. Verona has time to tell you about acupuncture and what it's all about.
Thank you.
And show you how it works on Loki.
I'll be
So,
super
there you
quick
go. Dr.
though.
Verona, share.
Thank you.
And Loki.
So if you guys don't mind, I'm going to put needles in while I talk. We'll combine this effort. So as I look around, I see I've done acupuncture actually on most of your dogs. But I wanted to maybe even answer questions you may have about it, because it is the specific insertion of needles in areas where there are bundles of nerves or specific pain to stimulate the nervous system, to do a number of things that include pain relief, in releasing endorphins so that an animal feels more comfortable. It's been around about a couple thousand years in animals specifically, which is interesting. I feel is very interesting. It's very safe. It clearly works, or can, or it wouldn't still be around. But unlike chiropractics, which is interesting, a veterinarian has to perform the acupuncture. So you can't get it from anyone but your vet. And it really, they don't really even notice, as you see, and that's my favorite first one because it's a stress reliever. But it's used for a number of things. I use it primarily for pain relief, whether that's acute or chronic, such as with hip and elbow dysplasias. A lot with dachshunds who go down in the back end and are paralyzed. And I've had a number of cases that with acupuncture and rehab and laser alone, we've been able to get them back up and walking without surgery. But it's great as an adjunct or an alternative to drugs. A lot of animals can't tolerate drugs because of kidney issues, such as this one. So it helps with relieving pain without using a lot of non-steroidals or steroids to get them out of pain. I was going to mention a number of other things that I've had a lot of success in using it for seizure control, kidney problems, kidney failure to just help stimulate blood flow to the kidneys, and a lot of GI issues. Helps with diarrhea or vomiting, stimulating the appetite. Good.
So she jumps is because that portion is tender?
Yeah, but then it releases pretty quickly. So one way that acupuncture works is that it introduces a new pain stimulus so that the body recognizes something new and sort of almost forgets the old pain. If only momentarily, it interrupts that pain cycle. Yeah.
Because nerves, the way that they work, like when one nerve fires, it turns off other nerves. So in your nervous system, when you have nerves that react to a certain stimuli, it'll turn off other nerves. And in doing that, you're relieving pain. It's amazing because you stimulate these little nerve fibers and the big fibers turn off. It's magic.
It's almost magical.
It is
It's
magic.
true. As Kelly can attest.
That was one of the biggest things was when you hit her neck. I was never so impressed. When you hit that part, she yiked only for the first 3 or 4 times, and now she doesn't.
Nope.
Because the pain is gone.
Exactly. Was there a question?
So, question on the needles themselves. Do you use different types of needles or a different metal for different treatment?
No, I personally don't. I use these stainless steel needles, and they are different lengths depending on how big the animal is.
Don't use sewing needles at home.
I usually will add electrical stimulation because there's new research that shows it helps release stem cells for better healing. But these are the only needles I use. I use them once. As you saw, I take them out of the package. They're sterile. And then once they're used, they're thrown away in sharps, and that's it.
Electrical stimulation means she connects a little probe or little electrode to a needle and sends an electrical current through the needle. And so it zings that spot even more to cause pain relief.
Correct. Yes. Yes. Thank you.
I don't know much about acupuncture.
So, would that be similar to a TENS unit?
It is very similar.
And do they respond favorably to that?
They do. You know, when I put the unit on them, you don't see that there's any more stimulation. They don't react, but I think we get a better response. And so typically, I have done dogs and cats, and they sleep better that night, people will tell me, and they can seem more sore in the next following 24 hours. A lot of metabolic toxins are being released, but then after that there's improvement. And depending on the condition, that will sort of dictate how frequently the sessions are.
In other words, don't use a TENS unit on your dog at home.
Maybe not. Yep.
I have a question. How many of you all have used Adequan in your dogs? Adequan is an injectable drug for joints that does wonders. Dr. Verona actually, on Bridgie, my old girl, used to do Adequan at her acupuncture points. And so she'd put 20 injections of Adequan all over her body. And because the Adequan would get into a little space and stay there, it would stimulate that acupuncture point for an hour or 30 minutes or however long until it dissipated.
Yep.
That was one of my favorite things. So don't forget to ask Dr. Verona to do that if she's around.
Exactly. It is a great added benefit. I'll just leave this open questions so that we have time to check out CBD and everything. Yes?
What about for behavioral?
So we have had some success with anxiety and stress. And it's hard because we don't quite know what triggers it all the time, but I've had a few cases where it's been beneficial. So you kind of have to just try and see. I haven't had much success with allergies in general in getting them to itch less, but in helping with the side effects of it, the alopecia and skin problems, I've been successful with that. So I'm not afraid to try. It will help with most things. Sure.
So is that Adequan similar to what an orthopedic person would use for me?
No.
Can I repeat the question so that they can hear it on Facebook?
Oh, sure.
The question was, is Adequan similar to something an orthopedic surgeon would use? Is that your question?
Similar to I think it's called cortisol?
Oh, Cosequin. Oh.
No, cortisol.
Cortisol.
This is not
cortisone.
It's a steroid,
No,
which is
it is
probably what
not.
they'd give you.
Go for it, Dr.
This
Verona.
is not a steroid.
So it's not at all like that?
It is not. I hear that we're going to talk about that.
We are going to talk about it next week, but it's
Next month.
Yeah, next meeting. So next month, but it's a polysulfated glycosaminoglycan. It's a fancy way to say building block of cartilage. It's that end portion. Mm-hmm. It's different than glucosamine though, so
Stick
it's a
around
different
after,
portion.
And we'll draw it for you
Yeah.
and you'll understand.
But it has a lot of
and explain it.
anti-inflammatory properties. It helps to break that inflammatory cycle within a joint in a few different ways. And we're really gonna dig hard into Adequan next.
We have 3 minutes left for questions, and I would love for it to be on a microphone. So,
I just wondered, for the acupuncture, is there like an exam that's required in advance, or?
So that's a good question, because if I have never seen your animal, I will do a full-on exam or a consultation. I want to know everything I can of what brought your animal here today and what got your animal to where it is. But if it's a regular client, as a lot of you are, if whoever you saw says, I think your dog or cat would benefit from acupuncture, then I would just do the service. And so there wouldn't be
doctor is
exam fee.
saying, this dog has a really bad neck and I really want you to see it. Or like we were talking about Shotzi's sister. Where's Shotzi's sister? You have a dachshund with a bad back. And I said, I think your dog needs to be seen by Dr. Verona. Anyway.
Yeah.
Yeah, because like my healer you've seen,
Mm-hmm.
and she's had x-rays 3 times, was prepped for surgeries, had an MRI, can't find what's wrong with her knee.
She needs Dr. Verona.
And she's still, Dr. Smith said, well, resume exercise, and she does okay if it's not a long hike, but if it's longer, then she's limping again that night. But MRI didn't show anything.
Oh.
And I just wondered if.
Those are tricky. I've had several of those, and they're like the mystery orthopedic case that people have looked up. I am still continuing to do acupuncture and seeing headway, but I think that the acupuncture allows increased blood flow to promote healing. It provides a way for the body to not only heal itself, but provide its own pain relief. So without any negative side effects, and you know, so it's worth pursuing.
Okay, it's 7:59, and I want to thank you guys all for coming.
Yes, thank you.
Very, very much. We really appreciate
Yay,
it.
everybody!
Thanks, Dr. Verona.
Thank you.
That was amazing. I would encourage you. Loki's got 20 minutes to chill with her needles in, so she's gonna go hang out. Well done, Loki. Feel free to stick around afterwards and ask questions and talk and visit with all of us. But we appreciate you coming.
I know. They're